Hi everyone, I am Dr. Anshul Jangra and today we will be discussing the topic of cell injury in pathology. It will be a quick revision video. So let's start our today's topic. So most common cause of cell injury is hypoxia. Next question is most common cause of hypoxia is ischemia, and cell most sensitive to hypoxia is brain, and cell most resistant to hypoxia is fibroblast. Now whenever there is an injury, it will lead to adaptation of the cell, then it will further cause reversible cell injury, then irreversible cell injury, and then finally cell death. Now, in reversible cell injury, the main cause is hypoxia. Whenever there is hypoxia, it will lead to mitochondrial dysfunction. Then it will cause decrease in ATP formation, and decrease in ATP formation will cause the failure of sodium-potassium ATP storm. It will be a first change in the cell injury. Now, normally what happens that this pump causes 3 sodium outside the cell and 2 potassium inside the cell. That is influx of the 2 potassium. Whenever there is failure, there will be influx of 3 sodium along with water, and the 2 potassium ions will be efflux out of the cell. Now, due to water influx, there will be hydropic change and lead to cellular swelling, and this will be the first morphological change of the cell. Now, it will lead to the swelling of myelin figures, which will be seen in electron microscopy. Now, in myelin figures, the first question is, it will be start in reversible cell injury, and it will increase in irreversible cell injury. And now, second question is about composition. Composition will be like this: phospholipid will be more than calcium. Okay. Now there is some question of myelin figures that myelin figures are derived from. The myelin figures are derived from. Please note down: derived from cell membrane. Okay, guys. So myelin figures are derived from cell membrane. Now, as we have seen that there will be decrease in ATP formation. Decrease in ATP formation will lead to some changes in the cell. Now, these changes will be, first of all, we have seen pump will be not functioning. Second one is anaerobic glycolysis. And third one will be in RER. Okay, first of all, we will talk about anaerobic glycolysis. Anaerobic glycolysis will lead to formation of lactic acid. Lactic acid. Now, lactic acid will cause decrease in pH. Decrease in pH will cause nuclear chromatin clumping. Nuclear chromatin clumping. Okay. Now, in RER, what happens that the ribosomes are attached to the RER. Okay. Now, these ribosomes will be detached. Detached ribosome. And ribosome detached will decrease protein synthesis. Okay. So ribosome अलग हो जाएंगे तो protein synthesis कम हो जाएगी. So you have to remember protein synthesis will be decreased and there will be nuclear chromatin clumping. Now let's come to another topic of irreversible cell injury. Now in irreversible cell injury, irreversible cell injury are 2 defining points. First of all is membrane damage, and second is mitochondrial damage. Okay, now let's see with the help of diagram. This is the cell. Okay, now there will be C. So there will be membrane damage and mitochondrial damage, and the calcium which is present, calcium will be leading to activation of enzymes like nuclease, phospholipase. Now, in mitochondria, there will be calcium. Now, calcium will lead to amorphous densities formation. It is very important to know that amorphous densities formation is related to 3 things. One is calcium, mitochondria, and irreversible cell injury. Now let's talk about some nuclear changes. It is very important to remember for NEET PG. Nuclear changes. So इसमें सबसे पहले न्यूक्लियर चेंजेस में इग्नोसिस होगा. इग्नोसिस के बाद होगा कैरियोरेक्सिस. देन होगा कैरियोलाइसिस। ओके, सो टिक्नोसिस का मतलब क्या है कि न्यूक्लियर कंडेंसेशन। न्यूक्लियर कंडेंसेशन कैसे होगी? लाइक दिस, न्यूक्लियर विल बी कंडेंस्ड। कैरियोलैक्सिस का मतलब क्या होता है? टूटना। तो क्या टूटेगा? न्यूक्लियर फ्रेगमेंटेशन। So nucleus will be broken down into fragments. Now कैरियोलाइसिस, लाइसिस मतलब डिसोल्यूशन, न्यूक्लियर डिसोल्यूशन। इसमें न्यूक्लियस डिसोल्यूट हो जाएगा, मतलब गायब हो जाएगा। इट इज अ वेरी इंपॉर्टेंट टॉपिक, प्लीज रिमेंबर द सीक्वेंस। So this is our today's topic of cell injury. Please revise it, and these are the important points regarding cell injury. So we will meet in the next video, and please comment on which topic do you want the upcoming videos for revision. I will try my best to make that topic. So thank you guys, and keep studying, keep pursuing. Thank you.